If you don't like the drug plan that you have, you might have heard of the OEP, which is the first 3 months of the next year. If you don't like your drug plan, can you change it during the OEP? Stay tuned, let me talk about it. Okay, let me save you some time. The answer is no. But you heard you could. I'm telling you the answer is no. But I read the answer is no. But I heard that the answer is no. OEP is January, February, March. And that will allow you, if you have a Med Advantage, to change from a Med Advantage with drugs to a Med Advantage without drugs, from one Med Advantage to another Med Advantage, to get rid of your Med Advantage and go back to original Medicare. And if you can qualify, to go back to a Medicare supplement and a drug plan. So there's a lot of things you can do, but one thing you cannot do is you cannot say, I have a Medicare supplement and a drug plan, and I've gone to the doctor, and they're not going to cover Januvia. I need to go to the other company that will cover Januvia. You can't. You cannot go from one drug plan to another drug plan during OEP. Why? That makes no sense. I know, y'all yelling, agents yelling, clients yelling, everybody's saying that makes no sense. It makes no sense. And we as an industry, our industry group, are working on that. It's just really hard to get stuff done with our current administration. So it's being attached to bills, and then the bill dies because some bad thing happens domestically or internationally. You know, if you follow the news, you can see that it's hard to get things through Congress because there's bipartisan support. The Democrats and the Republicans agree that that was an oversight when they brought OEP back. But when it came back, it only came back Med Advantage to Med Advantage, or Med Advantage back to Medicare supplement. The moving around the Part D wasn't in there. So we've been fighting for the last 2 years to get it put back in there, and everybody's very optimistic that it will come back. So if you do watch this video, let's say in 2024, you probably have it back. But if you're watching this video in 2021, 22, you probably still can't change from a Part D to a Part D. Now, that's not to say that you can't change from a Part D to another Part D, but you can't use OEP as the reason. Okay? You might have another reason, and that's where you need an insurance agent, and that's where it really matters what state you live in, because there's a lot of special exceptions that would allow you to change your Part D, even though technically you're supposed to be locked in for the whole year, depending on what plan you have, what state you live in, what income you have, the state rules. You might be able to change yours every single month, or you might have a rolling, or you might be able to do it every quarter. Or there's a lot of different rules that impact you. Maybe you're a veteran. There's a lot of things that might allow you to change your Part D that have nothing to do with the fact that it's the first quarter. Talk to an agent. Get help from a qualified agent that specializes in Medicare. Not somebody that primarily does home and auto or group health insurance for your employer and they do a little bit of this on the side. Somebody that really understands, because it's a very complicated topic, and you want a specialist. You're not paying anything for an agent, so get the best agent you can. If you don't have an agent, we'd love to work with you. If you just have a question and you don't even want to work with us, we'll answer it. Go into the comments, let us know how we can help you.